We are live. Welcome everyone to Skintox After Dark.
Hello.
My name is Nathan Strom. Next to me, this side is
Aundrea Trevors.
And down below, we're lucky to have Dr. Ian Landells with us from the Landells Clinic.
Nice to see you all.
Thank you so much for being with us tonight.
Thank you.
My pleasure. It's a lot of fun. Good way to spend a Friday night.
It is. And I think because it is a Friday night and because we're close to coming out of isolation, we should celebrate a very special person's birthday. Someone had a birthday yesterday, so I would like to have a big cheers to Aundrea and say happy birthday to you.
Oh, thank you so much.
Happy birthday. Are you confessing your age?
The big 4-0.
Wow. So when we get out of isolation, we're gonna have to connect the three of us and do some shots to make up for this.
Deal.
That has to happen in Newfoundland, I think.
Yeah, maybe we could go kiss the cod.
Have you been screeched in Newfoundland yet?
I have.
Okay. Done deal.
Yeah.
Awesome. So, Dr. Landells, talking about having a few drinks, I know that you have a few local breweries that you'd like to have a shout out to tonight. So who are they?
Oh, always. Well, about 100 meters from my house is the Bannerman Brewing Company, and I'm a big fan of that. That's actually what I have right now. It's one of their pale ales. And I'm having it out of a glass from one of my other favorites, which is the Port Rexton Brewery. And I can think this way. If you go this way.
Oh, look at that. I love it.
Yeah.
And then the one everyone's heard of course, is Dildo Brewing Company.
Yes.
This way.
Wow.
Oh, I love it.
I've heard of that because Jimmy Fallon decided he wanted to become the honorary mayor of Dildo, which is a community about 50 minutes outside of St. John's, and they make delicious beer. And then finally, the Kitty Vitty Brewing, which is also a short walk from my place, make one of my favorite beers called Day Boil. Day Boil refers in Newfoundland to when you start drinking in the early afternoon, you're having a day boil. So, so thanks for that opportunity. We have a lot of excellent breweries here, and they make outstanding beer.
Yeah, so all those people out in St. John's, get down to those breweries, support local businesses, guys. This is the time to do it. Also, check out the Landells Clinic on Facebook at Landells Clinic or on Instagram at Landells Clinic. And the best reason to check them out is they've actually done some new renovations recently, and I can't wait myself to get out there and see them. But when it's safe to do so, I think it would be worthwhile popping in to seeing Ian, Catherine, and the team at the Landells Clinic to see their beautiful renovations and catch the man himself that we're talking to tonight. So without further ado, I'm going to pass it over to Aundrea tonight. For everyone who's tuning in, we're going to be talking rosacea and acne, and there's probably no better person to talk to it, to these two skin conditions than Dr. Ian Landells. So take it away, Aundrea.
Awesome. Thank you so much. Again, thank you so much for joining us. We're really honored to have you on the show today. So let's jump into rosacea. So can you give us a little insight about rosacea? Kind of what causes rosacea? What's kind of happening to the skin as somebody's going through that type of inflammatory process?
I think that's an incredibly important question. And anytime I see somebody with really any skin condition, whether it's rosacea or acne or anything else, I try to explain to them what our understanding of that condition is, why it's happening, what could be making it worse, what could be making it better. Because I think once you understand that, you have a better handle on how to treat it. And you'll also embrace the recommendations that we give far more if you understand why. If we just say, don't do this, without explaining why you shouldn't do that, then people go, well, I don't know. And of course, there's a lot of misinformation online. You can go online and see all kinds of stuff. And, I always describe the internet as being this place. It's basically a big bulletin board that's very fancy. You can post whatever you want up on that bulletin board, and it looks incredibly enticing and believable, but it's not necessarily true. So rosacea is a condition that's caused by a combination of genetics and environmental influences, triggers. And there seems to be a combination of these things. So some people are far more genetically predisposed, while others have been exposed themselves more to these environmental triggers. and they have a little bit of a predisposition. And if they get a lot of the triggers, that brings it out. But some people are just destined to get it, and the triggers are still a problem, and they need to avoid them. And essentially what happens is with sun exposure, and that's the biggest cause and trigger of this condition. With sun exposure, the blood vessels in our face, and if you think about where rosacea occurs, and if people don't know what rosacea is, it's a condition where the face flushes very easily, and over time you can get lots of little pimples developing. The most common areas to be involved are across the teeth, sort of across the forehead, down through the mid face, the chin, and these are, of course, the most sun exposed areas of our face. So in the areas where the sun's been exposed, the blood vessels become very, very sensitive to a variety of triggers. And when you're exposed to those triggers, the blood vessels overreact, they expand, they dilate, more blood flows through these areas, and you flush. That's what flushing is. It's more increased blood flow in these areas. Then they contract down again. But over time, this happening over and over and over, what happens is the blood vessels become like balloons that have been blown up one too many times. And they lose their elasticity, and they don't snap back anymore. They remain enlarged, and you start to look persistently red. So across your forehead, usually the nose, again, the cheeks here, you'll see persistent redness, and then you'll start to see visible blood vessels over time. And you get these, what we call telangiectatic vessels or visible blood vessels, again, in these areas. And then the next step is with increased flushing, the blood vessels become weak, and the walls become leaky, and they leak inflammatory mediators, and they leak out into the surrounding tissue, and this creates a chain reaction of inflammation that leads to little red pimple-like bumps. It's a little bit different from acne. You don't get whiteheads or blackheads, but you get all these little red bumps, and you'll see some people, and they're studded with all these red inflamed pimples, and this is obviously very distressing. The redness alone is very distressing, but the bumps are incredibly distressing. It looks like horrendous acne, and people don't know how to control it. And as far as that goes, there's good news and bad news. The good news is it's very controllable. The bad news is there's no cure. And so the way to control this is to identify and avoid the triggers, the things that make that you're really sensitive to, that make you flush more, because flushing is the problem. Flushing is the fuel for everything else. The enlargement of the blood vessels, the pimples, it's all driven by this flushing. And so there are a bunch of triggers that I tell people to avoid. So number one is the sun. And you don't avoid the sun. You don't stay out of the sun. You protect yourself from the sun. So sunscreen is the number one treatment for rosacea. And a lot of people go, what? What are you talking about? Yeah. I read that there are these creams. There's metronidazole creams, and there's this, and there's that. And all the prescription creams are just for the inflammation. They're for the pimples. They're not for the flushing. And if you don't control the flushing, the rest is a waste of time. So daily sunscreen is critical. Very, very important. Just put it on every day. Minimum SPF, preferably of around 40. And you can go higher if you want to. And another thing a lot of people don't recognize is that physical sunscreens are better for controlling this than the chemical sunscreens. And that's because the second trigger that you need to avoid is heat. So hot baths, hot showers, hot tubs, saunas, hot environment, all of these things, obviously when people get warm, they flush, and people with rosacea flush that much more. So I'm going to take it back to the sunscreen again. And the reason physical sunscreens work better, and for those of you who aren't familiar with the differences between physical and chemical sunscreens work by converting ultraviolet radiation into heat. So when it hits your skin, the chemicals convert that radiation, that UV radiation, into heat. It's liberated out, and the UV doesn't get down to your cells and cause the damage that we don't want to have occur. Physical sunscreens work like a shield, and the UV radiation bounces off, and they don't generate heat. And as I just said, heat is the second big trigger. So there actually is the ability for chemical sunscreens to make your rosacea a little bit worse by creating more heat in your face. So physical sunscreens are better. The ones that contain zinc or titanium, they are better and for rosacea. Heat, as I said, is worse. It makes things worse. Cold is another trigger. So cold wind on your face in particular. Parents, your hockey parents who go to arenas and they sit in the arena for a tournament all weekend and they're exposed to the cold, that will make it worse. But cold wind's a big one. And, we had cold wind today. It was 16 degrees in St. John's. The UV index, I'll point out, was 6, which is very high. And yet the wind was quite cold. And a lot of people would have gone out and said, it doesn't feel that hot. And they would have had 2 major triggers. They would have had the UV radiation and the cold. Besides heat, cold, and sun, you've got alcohol. And, cheers.
Cheers, everyone. Cheers to a rosacea.
And unfortunately, certain types of alcohol make people flush more. And a lot of people, when they come in, they'll say, yeah, I do find red wine in particular. So red wine tends to be worse than white wine. Hard liquor tends to be worse than beer. And it varies. And it's a very individual thing. So people need to recognize and acknowledge what makes them worse. And if that's a problem, and if even white wine makes you flush, then if you want to keep drinking, and I think there's been a lot of that during the COVID-19. If you want to keep drinking, you can dilute that down. So you can take some white wine and add some soda water and make a spritzer, and that will dilute it and make it less of an issue. So alcohol is another one. Spicy foods for some people can be a trigger. And again, these are not universal, but the heat and cold and alcohol generally are. Spicy foods and hot liquids, hot tea, coffee, soup, let them cool down. It's not the caffeine so much, although caffeine can influence some people. It's mainly the temperature. People who drink piping hot tea or soup. And even your food, if you drink it really hot, that will make you flush. And getting in a hot environment will also make you flush more. So ways to mitigate that, like I said, let the tea or coffee cool down. You can actually drink ice water, cold water to cool your core body temperature down, because what seems to be happening is people with rosacea have a different set point, so that when their body temperature increases a little, their body reacts like it's increased a lot. And as a result, we give heat off by flushing. That's the way our body gives off heat. So by drinking ice water, if you exercise, for example, that's going to make you warmer. If you drink ice water, cold water, that will help. Spraying your face a little bit with cool mist, with a bit of cool water, that will help as well. And the one thing none of us can avoid is stress. And stress is a factor as well for rosacea. And I wish I knew how to offset that one, but that's something that you just need to live with. So that's what I tell people. Rarely, and I really underscore rarely, certain foods can be triggers. And when people can't figure out why they're flushing, how to get it under control, I say start taking a dietary history, keep track of everything you eat and drink, and identify when you flush. So if you flush, look back at your little history and say, okay, what was I eating or drinking? The best way to do that is just get a little notebook, write down everything you eat or drink, and when you flush, put a little star at that point in the day. And you can go back after 2 weeks and look for consistencies and say, oh, look at that. Every time I ate bananas, I flushed, because bananas have been implicated. Spinach, beans, I know this is odd, soy sauce, vinegar, citrus fruits, tomatoes. These are things that have been implicated as triggers for a small number of people with rosacea. And so those are the things to avoid.
Okay, that's interesting. I'm learning so much. So you kind of said if people understand, why it's happening and what's happening, and you get them to implement these things, do you see a pretty good reduction in say the flushing of their face, like putting sunscreen on and stuff like that?
Yeah, a lot of the time, I've had patients, and what's really interesting is some people have particular triggers that are a big factor. I remember vividly having one patient who came back and said, bananas, who knew? Bananas and I'm good. Other people said I stopped going into my hot tub, and that worked. But for most people, it's a combination of things, and sunscreen is the most important thing, because not only is it a cause, not only does it create the damage within the blood vessels, it's also a trigger. Yep. So it will make things progress, and it will make you flush and make it progress in that respect as well. So yeah, people can often control their rosacea simply by identifying and avoiding their triggers, and that is the most important aspect. And if they're not willing to do that, everything else is irrelevant.
Right.
You can use all the prescription creams in the world, they'll continue to get pimples because that flushing is continuing.
So you talked about it progressing. So does rosacea get worse as somebody ages?
Yes. So it's not necessarily as they age, because rosacea, I've seen kids with rosacea. It will progress as time goes on if they are exposed to those triggers. So yes, no question. And there are different varieties of rosacea. So for most people, it begins with just the flushing and the redness. And so as some of my patients say, they have high color. That's a term that I've heard a lot. And so they flush, they redden, they get progressively worse. Some will then go on to start to develop those pimples, and that's what we call inflammatory rosacea. And then some people will actually start to get inflammation of their eyes. And there's a condition called ocular rosacea, where they get dryness of the eyes. Their eyes feel gritty all the time. They can get styes, little bumps and pimples around the eyes, and they get this grittiness in their eyes as well. And then finally, there's a type called phimosis rosacea, which is what a lot of people think of as where the nose starts to enlarge. They get increased size of the oil glands, the sebaceous glands in the nose, and the nose will actually start to enlarge. And so Bill Clinton was a prime example of that, W.C. Fields. And if you look around, you'll see people who have this enlargement of the nose. That, fortunately, is unusual. That's quite unusual.
We just have a question, and I'm going to bring it up for you, Dr. Landells, just so you can see it. So it's just underneath here. Can you read that?
Yeah, so best way is to cool the skin after the skin has become flushed. Great question. I thought it said Nicole Kidman there for a second.
Thank you, Nicole, for the question.
Well, rosacea, the curse of the Celts. So anyone with red hair, my hair was red once. Red hair, fair skin, blue eyes, and she's a prime example of somebody who'd be prone. So to control the flushing, as I mentioned, drinking ice water, cold water cools the core body temperature down. That can reduce it. That can mitigate the flushing. You can spray your face with cool water, and that also can reduce it if you're exercising. And there's a prescription product called Aundrea that you can prescribe, and that is like Visine for the skin, and it vasoconstricts temporarily. It's just a temporary thing. It doesn't fix the problem. It just reduces that redness for up to 12 hours. So those would be the best ways to reduce the flushing.
Cool. Thank you for that question, Nicole. And I've got a quick question. I want to jump the gun. It's a question about, I have a little bit of rosacea, and I find that when I work out, it starts to flare up a bit. And I always thought it was because of the sweat. But what you're telling me tonight, it's because of the heat.
It's your body warming up, yeah.
Okay. So the sweat has nothing to do with it then?
No.
As a trigger?
No.
Okay.
So I guess basically if you are working out, on a team or something like that, keeping like a little spray bottle or something to just like literally spray off your face, or continuing to use cold water is a good way to fight it.
The water absorbs the heat as it evaporates off. And so, yes, that will help.
And just on the sunscreen thing, Dr. Landells, because we always talk about sunscreen and we know we should use it every day, but there's always that, how often should I be reapplying? And from your professional opinion, like, I know there's different kinds of lifestyle, like if we're down in like an all-inclusive resort, or if we're doing a regular work day, like in your opinion, how often should we be applying sunscreen? Maybe in like the two different situations, whether we're on holiday in the sun all day or we're going to work.
Well, we recommend putting sunscreen on daily, and especially if you have rosacea, daily application of sunscreen is critical. It's absolutely critical. And then reapplying every 2 to 3 hours if you're outside for any length of time, or if you're sweating, if you are swimming or get wet, you should reapply immediately after, because even the waterproof or water resistant sunscreens, all that means is it doesn't come off instantly. You know, when you get into the water, or if water hits your face, it doesn't immediately disappear. And if it doesn't say water resistant or waterproof, it will literally immediately be inactive. So use a water resistant one. Most of them are these days, but it means probably every 2 to 3 hours is a good time. And nobody really knows. There are no hard studies. They just know that as time goes on, it becomes less effective. And so what we say is every 2 or 3 hours.
And it's got to be a physical one, so something with zinc or titanium in it.
Or both, yes, exactly.
Or both.
Yeah, that works best.
Mm-hmm. And those ones tend to be a little bit heavier. They almost look more like a white substance on the face when you're putting those ones on, eh?
Not anymore. Not anymore. There are a lot of really, really elegant preparations now of the physical sunscreen. That's all I use personally. Mm-hmm. And there are a number of good ones, and they can come as tinted or non-tinted. Some people find some of them leave them looking a little white, even the lighter textured ones, and some of them have a little bit of tint to offset that. So it really isn't an issue anymore.
And if you're in the St. John's area, just head down to the Landells clinic, because the girls there know their sunscreens and they've got a lot of options there. I've been to the clinic on several occasions and they'll be able to help you out.
Yeah, we have a lot of samples, and you can actually try them on, see how it feels, see what it looks like on your skin. Because I always tell people the best sunscreen is the one that you like and are willing to put on every day. If you don't like it, if it doesn't feel good on your skin, if you don't like the way it looks, don't get it, because you'll never use it.
Okay, I've got another question here, so we'll just bring it up. Just give me 2 secs, team. I just have to click around here. So what is the name of a good physical sunscreen from Jan?
Okay, so Jan, there are a lot of very, very, very good physical sunscreens. Vivier has some great physical sunscreens. Skinceuticals has some great physical sunscreens. Illumier MD has good physical sunscreens. Antelios has a nice one. Aundrea is a little heavier, but it's still a drugstore brand that you will find. And beyond that, even Coppertone is a physical sunscreen. As you get into the drugstore brands, they tend to be a little heavier. They tend to leave your skin looking kind of white, as we just discussed. But all of these would be good options. They all work well. And like I said, you have to find one that you're willing to apply and look at yourself in the mirror and say, yeah, I like that. I like the way it feels. I like the way it looks. So the first ones I mentioned tend to be the more elegant preparations. They're all effective.
Awesome. We've got some more questions here. Well, we've got a comment here. There's a good comment here. Carmel has just said, got my sunscreen from Landells and love it. So that's awesome.
Thank you.
Yeah, and then we've got Kristen who's got a question about IPL.
Okay, well, we haven't even really gotten into the treatment of rosacea. Yeah. So would you like to talk about treatment?
Yeah, go into the IPL and some of the treatment methods you can use in your clinic and other clinics that help with rosacea. That'd be great.
I always start off by saying, again, if you're not using your sunscreen and you're not avoiding the triggers, nothing else is going to work. However, if you are doing that and you're still getting the pimples, there are a variety of prescription products that contain ingredients like metronidazole, azelaic acid, and there are oral medications. There's another one with ivermectin. They're all designed to reduce the pimples that develop. Oral antibiotics like doxycycline, and there are ones with lower doses. There's one called Aprelon that's a very low dose that's specifically designed to control the inflammation. That's all those are for. They're just for the inflammation. So if somebody is prescribed Metrogel, noritate, Finacea, Rosivir. They are just for the pimples. So they are not designed to reduce the flushing. The only way to reduce the flushing is to avoid the triggers and wear your sunscreen. For the redness, and I'm coming back to Kristen's question here, for the redness, IPL, which stands for intense pulse light, it's a type of, it's like a laser, but technically it's not laser because it's not a single wavelength of light, it's a spectrum of light. It targets the blood vessels that are abnormally enlarged. And that will, yes, reduce the redness if and only if you continue to wear your sunscreen and avoid the triggers. If you don't do that, you keep flushing, you just get red again. So it will reduce it temporarily. If you don't avoid the triggers, it will reduce it progressively and stay that way if you continue to avoid the triggers. So yes, excellent treatment, worked very well. And I just have to stress, it won't cure your problem. You still need to avoid the triggers and wear sunscreen.
And can you see sometimes if you have that model patient that's doing everything that you want them to do, and say they're avoiding their triggers and they're having, say, a treatment of intense pulse light done, can you see sometimes a remission we know that it doesn't cure it by any means, but can you see like a remission that can last for a little bit with following all your guidelines?
No question. Absolutely. And I see lots of people who've started off using all these creams and they're getting the IPL, but they are religiously following all the recommendations, and they can step back. They stop using the creams. They're just wearing their sunscreen, and they can either dramatically reduce the frequency of their IPL or even stop it. Yeah.
And how long would you see, like, I mean, I guess it's different with everybody, but
I would give it a year and a half.
Okay.
Yeah, within a year and a half, if you're doing all the right things, then you should do very well, and many people will see a remission. Some people, however, have a big inflammatory component and they keep breaking down. And we will use isotretinoin, which most people know as Accutane, or Epuris is another version of that. And that's a pill we use for severe acne. And a course of that over about 7 months can dramatically reduce the inflammation of rosacea. So we'll do that as well.
Fantastic.
That's awesome.
Wow, we talk a lot about rosacea.
You know what? Like, we're hovering around the 30 viewers, which is very high. So it's people are listening. We're getting questions coming in. So we've done rosacea. We can come back to it if more questions come, but I'd love us to move on to acne now, because that's kind of the other one that I think acne is something that pretty much everyone's had an issue with at some stage of their life, and it's a huge deal, especially obviously growing up as a young kid, like being teased and bullied at school. Like it can cause a lot of stress, not just on children, but the families involved as well. So can you explain to us what's happening in the skin to cause acne?
Okay, well, first and foremost, Nathan, thank you for pointing out the impact this has. It's huge, absolutely massive. And anyone who's had any degree of acne, and most people have, I would challenge anyone I know to say they've never had a pimple. And even one pimple at the wrong time, people are upset. They're trying to cover it up. And, oh man, what am I going to do? Imagine having that all over your face or all over your back or all over your chest. And it is incredible the impact this has emotionally, psychologically, and socially on people. So what causes acne, as we understand it today, is, again, it's always a combination of factors. So first of all, again, there's genetics. And what people inherit if they have acne in their family is a tendency for their hair follicles in certain areas in particular to be clogged with skin. And that's caused by the fact that they have what's called dyskeratosis. So our skin is shedding all the time. Our skin grows over a period of about 6 weeks, and from the bottom layer to the top, and then it sheds. And the lining of our hair follicles, which are all over our body, we have hair follicles everywhere. Those hair follicles are lined with the same skin that develops over 6 weeks and sheds. And it will then sort of migrate up through the hair follicle and then out and is shed. In people who tend to get acne, those skin cells don't shed as individual tiny skin cells as it does in most people. They shed as sheets or clumps of skin cells, which are much larger. And as you can imagine, if they're trying to get up and out of a hair follicle, you plug it up. You can't get out, and it creates a plug. And that plug then, in turn, creates a backlog of oil or sebum, which is always being produced in our bodies. And that's the second factor. So you've got the dyskeratosis, and then you've got the sebum. Our oil glands are actually attached to our hair follicles, and they pump the oil not directly to the surface of the skin. They pump it into the hair follicle, and it has to go up and out of the same opening. And you can imagine if that's plugged up with those skin cells, it can't get out. And when it can't get out, the oil gland just starts to swell and bulge and turns into a white bump called a comedone or a whitehead. So a comedone is basically a mixture of that oil and those skin cells that can't get out because more skin is being shed. It's all backed up, and it just backs up and turns into these little white bumps. And that's why you'll see all these little white bumps in certain areas of the face, the back, the chest. If a little bit managed to protrude out through the opening of the hair follicle, it actually oxidizes with air and light and turns black. And that's what a blackhead is. A blackhead is that same whitehead, except a little bit sticking out. It's reacting to air and light and turning black. So it's not dirt. A lot of people say, oh, blackheads, you got to scrub your face. That's just dirt. It is not dirt. Let's set the record straight right now. Your parents were wrong. You're telling your kids that, you are wrong. So it has nothing to do with their hygiene. It's not because they don't wash their face enough. It's not the junk food they're eating. It is genetics that you probably gave them. So for your fault. And so it's genetics and it's the oil. And what happens when we hit puberty, of course, and this is when acne tends to flare, is the hormones that start to surge in our body cause more oil production. Our hair becomes oilier, our skin becomes oilier, and so those sebaceous glands they go into overdrive and they produce way more sebum. So for a lot of people, they get by. Those plugs aren't causing a big problem until they hit puberty, and that's when all that extra oil is being produced, and that's when they swell up. And then over time, the backed up oil and skin will get bigger and bigger and bigger and bigger until in some people, the follicle ruptures. It can't get out, so it bursts. And that creates a reaction, almost like a splinter in your skin, because all that material goes out in the surrounding skin, and it's treated like a foreign body. And we react to it by creating a lot of inflammation.
Yeah.
The other thing that happens is we have a bacteria that lives in our skin, P. acnes. It lives in all of our skin. It lives in our hair follicles, and it loves that environment of the oil in the skin, and it multiplies madly, and it creates a chain reaction where we react to it and create inflammation. So that's why you get the little pustules, the little pimples, and then the nodules and cysts that develop are more from those ruptured areas where we react and we get big nodules and huge areas, and that's when scarring occurs, and we get terrible scarring. And that, of course, is the worst thing that can happen with acne. It's bad enough living with acne as a teenager. It's horrendous. You want to hide, and there have been studies done that have shown that teenagers are less likely to interact socially. They're less likely to date. They're less likely to go out with friends. And what's really disturbing is there are also studies that have shown that people with severe acne have poorer academic function. They actually don't do as well in school, and they have higher unemployment rates.
Wow.
Which is mind-blowing. This is all carefully scientifically proven. And the unemployment thing really made me think a lot. And it made me realize that probably occurs for two reasons. Number one, you can imagine somebody with bad acne, their self-esteem is in their boots. absolutely in their boots. They feel terrible. You know what it's like to have a bad hair day. You know,
Yeah.
messed up. Geez, I just don't feel. Imagine your face is always a mess.
Yeah.
And so their self-esteem is in their boots, and so they don't present well in an interview. The other thing is, and this is really disturbing, but as an employer, you can imagine if you have multiple people interviewing and one of them is covered with acne, you're thinking, do I want that person, serving my clients? Right or wrong?
Yeah.
I think it's wrong, but right or wrong, they are probably going to hire the other person. So there are lots of reasons to do this, but the main reason to treat acne aggressively and to take it seriously, and I really beseech any parent who has a child with acne, take them seriously. Don't say, oh, you'll grow out of it. Don't worry, it's going to go away. I had acne. I grew out of it. It's not fair. We have lots of treatments. We have lots of very, very effective treatments that can get it under control, keep it under control, and save that child's life in many ways. And one of the most gratifying things I do, and I do 2 pediatric clinics a week where I see kids up to 18 in that clinic, and I see a ton of acne. One of the most gratifying things I do is take a kid who's there looking down. They won't look me in the eye. They barely want to speak, and they're trying to tell me about the acne. And I treat them, and they come in. They're smiling. They're engaging. They have eye contact. It's life changing for me.
Yeah.
I really can't express that enough. And anyone who's got a child with acne, they should understand that this is having a huge impact on their life.
Okay, we've got a comment here. We've got a comment from Jackie about the Vivier acne kit being great for teenagers, and I'd have to agree with Jackie there. And then we do have a really good question here from Natalie Campbell. Can you see that, Dr. Landells?
I can. And that's a really good question. Is Natalie pregnant, I wonder?
Well, congratulations if you are, Natalie.
So that's a really, really good question, because the mainstay of treatment for most people with acne is the use of a retinoid, what we call a retinoid. And that's a vitamin A derivative. And so retin A is the classic one, retinol. These work really well at normalizing that shedding of skin, that dyskeratosis. They take about 6 weeks to begin working, 2 to 3 months to really improve things, but they can open up the follicles and prevent that plugging. However, vitamin A can cause birth defects.
Yeah.
And so you should not use it if you are pregnant. And so there are a lot of treatments. We know that one causes birth defects, so don't use it. There are other treatments that have not been tested, and the majority of treatments have not been tested in pregnancy because no ethics committee in the world is going to approve a study that says, oh yeah, we're going to take 100 pregnant women and we're going to expose them to this product and see how many of them have birth defects. That's never going to happen. So there are a lot of treatments where all we have are these anecdotal reports of people who've used it, they became pregnant, what happened. So the ones that we know benzoyl peroxide is safe, we know that topical antibiotics are safe. So things that contain benzoyl peroxide and clindamycin, that's okay. Beyond that, we really don't know. Salicylic acid is a common treatment, but excessive amounts of salicylic acid, if they're absorbed into the body, can affect a child. The bottom line is the amount that people use spot treating a few pimples, it's not getting into the body, but we don't know. Light treatments are effective for people with more inflamed acne. So if you've got a lot of inflammatory acne, we can use certain oral antibiotics to calm it down. We can also use light-based treatments. So blue light treatments can be helpful to calm down the inflammation. UVB, UVA, UVB in particular can help. That's anti-inflammatory. But with the UV treatments, we know that excessive amounts increase your risk of skin cancer down the road. The amount you would get treating acne is probably negligible, but you're probably safer going with visible light, like blue light treatments.
Awesome. So I've got another question. Can you explain a little bit about cystic acne and why that's such a difficult thing to treat?
Well, cystic acne is when, if you recall what I was describing, how the hair follicle just keeps getting bigger and bigger and bigger and bigger, and eventually ruptures because all that oil and skin can't get out. So it ruptures, creates a chain reaction, and that can lead to scarring. So cystic acne, if you see a nodule or a cyst on the skin, that is something that can lead to permanent disfiguring scarring. And that, I tell family physicians, I tell dermatologists, I don't need to tell dermatologists, but family physicians, pediatricians who see acne early on, look for scars. Look for scars early. The smaller, the better, because you're catching it as early as possible. Because it's very difficult to undo that scar, and we can prevent it. And if you see any degree of scarring, if you see any nodules or cysts, these large lumps on the skin, then they need to be treated aggressively. They probably need that isotretinoin I talked about, which is Accutane or Epuris. And that it's the only cure that can actually shut acne down, cure it. And so that's very, very important that they get that. And the other thing I'll point out is some people have a bit of acne on their face, and their back, their chest is studded with nodules and cysts, and they're getting horrendous scarring in their back. So always ask people about their back or their chest. They're not going to volunteer. And I've seen people, they won't swim publicly. They won't take their shirt off ever. And I mean ever again in their lives, because they are covered with scars on their back or their chest.
Talking of scars, we have a question from Angela here. What are some of the treatments or products that we can use for acne scarring?
So for acne scars, obviously prevention is best. And I'm a firm believer in prevention and catching things early, but obviously you can't always do that. So if there are scars that are developing or have developed, you can treat them. Chemical peels are very helpful. You can use things, products that contain glycolic acid, retinoids, topical vitamin A preparations. Retinol can be very helpful. Salicylic acid, to a certain degree, glycolic acid tends to be better, but then you can actually get into chemical peels, retinol peels, glycolic peels. They can help to remodel the collagen, and then ultimately you can get into laser treatments where you're actually resurfacing the skin with ablative lasers. And so profractionated laser is really helpful, and that's a way of using erbium laser light to vaporize the surface of the skin. It sounds horrible, but it actually is much better than people think. But it ablates the very surface layer of the skin, and then uses a scanned laser to drill little microscopic burr holes, and that causes the skin to tighten and smooths it out significantly. That's the Cadillac treatment. And that's much easier. There's about 2 to 3 days of downtime, and that's all when you do a laser like that. But it works incredibly well. However, it will never give you the skin you had before you had acne, before you got these scars. It will improve it, but address acne early. And if you see any scarring, seek treatment quickly. That's why we set up an acne clinic at our clinic, was to try to facilitate that process so that people with significant acne could get in and get treated quickly, and we could prevent more scars from occurring.
Cool.
Do you guys do microneedling?
What's that?
Do you guys do microneedling?
Yes, yeah, we started doing microneedling as well, and that's the same principle as the laser. It's sort of a kinder, gentler way of doing it. It's not quite as aggressive, and you won't get quite the same effects. But yes, microneedling is another option.
And just on acne, are there any foods or guilty pleasures we should be avoiding if we are struggling with acne?
Well, I certainly wouldn't recommend avoiding anything just because you have acne. There's a lot of myth out there. And as I mentioned, it's not dirt. So it's not because teenagers are dirty and they don't wash their face enough. It's not because they're eating chocolate. It's not because they're eating greasy foods. There's no science out there that shows that any particular foods make acne worse. I tell people, if you find there's a food that makes you flare, if you eat chocolate and you break out every time, then avoid chocolate. But don't avoid chocolate because you have acne. The only studies that have ever shown any link to a food would be dairy products, and that was it was only with skim milk over whole milk. And it was felt because it's actually the glycemic index. So if we raise our glycemic index, it increases our insulin levels, and higher insulin seems to be related to acne. So skim milk is the only thing. So I have an ongoing argument with my daughter's boyfriend, who he calls milk acne juice. And I said, listen, man, dude, there's no evidence to support that. So he always talks about the acne juice. And there's no evidence to support that. And thank God, because I'm a pizza fanatic, and cheese on pizza is critical.
Yeah. So we've got another really good question here from Tina. I'm just going to bring it up. Can you see that?
Yes.
Yeah. And she's just also mentioned that she also has pimples on her chest area as well. So are you able to talk to this question for us, please?
Well, Tina, the most important thing would be to seek the help of your family physician to get this treated, because first and foremost, she would need we haven't even talked about the treatment. We've danced around it a little bit, but the foundation of treatment for acne is a retinoid, vitamin A preparation, prescription, or if you can't access that, an over-the-counter one like retinol, that should be applied daily. That normalizes the shedding and prevents the blocking of the pores. That can be combined with benzoyl peroxide, which helps to dissolve the plugs in the skin. And benzoyl peroxide has been around for decades, works very well. Topical antibiotics can help with the inflammation. Oral antibiotics can help with the inflammation. If they're red, inflamed pimples, they can help as well. Doxycycline, minocycline. In women, you can use hormonal treatments, the birth control pill. So an 18-year-old who's getting a lot of pimples, there's a birth control pill. It's actually an acne treatment that works the same way as a birth control pill called Diane 35. That could work well. But there are a number of very good birth control pills that can help. But keep in mind, there are birth control pills that can make acne worse. So make sure your physician knows which one you should be using. And whatever you do, avoid Depo-Provera, which is the injection that some women get. It prevents periods, and they get it every 3 months. That is acne juice. That is like rocket fuel for acne and will drive it crazy. The back can be a problem, and so you would want to combine these treatments. It's very important you not use one and then stop and try another, because the vitamin A is going to prevent the blocking of the pores. The benzoyl peroxide will open it up. The antibiotics will help to decrease the inflammation. So these things should be used in combination, and that's critical. Any treatment should be combination. And there was a mention earlier about the acne kit. That's a combination therapy that will work on several aspects, so that could work well. But if there's any degree of damage, as you mentioned there, get to a family physician, and if they're not willing to prescribe Accutane or a Purist, get a referral to a dermatologist, because to me, scarring acne is a dermatology emergency. This is the worst possible thing that can happen as a result of it. They will be seen urgently in our clinic if that's the case, and that's the way it should be.
Awesome. We've covered a lot today. We've covered a lot, and you know what? I've learned a lot today, which is great. We've got a lot of questions. That's the most questions we've had on Skintox before, so I'm kind of excited. It's not often you get to talk to a dermatologist, though, which is crazy. And it's like, thank you so much for coming on, Dr. Landells. It was much appreciated. And for those of you who are in the St. John's area or are planning to visit there very soon, please check out the Landells Clinic. Catherine and Dr. Landells and the girls there are a wonderful group of people, so knowledgeable. They've just renovated their clinic, and I'm jealous that we're in isolation because I really want to come and see it.
It's beautiful.
Yeah, I can imagine it's beautiful because it was beautiful before the renovation, so I can't wait to see it afterwards. But also, we've talked about, I think one of the big things we've talked about today is sunscreen. And the second thing we've talked about is really not ignoring people's help when people are asking for help in regards to acne, especially young children. I think it's really important that we do send our kids to the family doctor, and we do get a referral to the dermatologist to get ahead of it, because preventing it is the best way to avoid it from a risk management point of view. Would that be right, Dr. Landells?
I couldn't agree more. Never underestimate the impact any skin condition or disorder has on a person. On the face, it's the first thing people see. And any visible difference, we live in a strange society where visible differences, unfortunately, make people stand out, and some people discriminate against that. And that's just one thing, but it affects how we feel ourselves. It shouldn't. We should not feel any differently based on how we look ever, whether it's our hair color, our skin color, anything. We should not feel differently, but unfortunately that happens. And so when you have something that's disfiguring, that's creating this difference, and can be addressed and can be corrected and prevented, why not? Why wouldn't you do something about it and do it as quickly as possible? So I can't underscore that enough. So thank you so much for giving me this opportunity.
No, we loved it. Aundrea, do you have anything to add before we say goodnight to people tonight?
I don't. I mean, I've got so many more questions. We'll have to have you on every week.
I'm happy to come back sometime.
Yeah, well, you know what? We'll have to get you back in the next couple of weeks. We'll bring up another couple of topics that we think will be good, because it's such a pleasure to have a dermatologist on. And happy birthday once again to Aundrea.
Yes, happy birthday.
A big cheers to you.
Excuse me, the cheers.
Thank you.
A cheers to everyone out there. Keep staying safe, everyone. We're really, really close. More provinces are opening up. We're getting close to getting the better of this virus, hopefully. Fingers crossed, legs crossed, everything's crossed. And we look forward to seeing you guys next week. We'll be posting on the Skintox Facebook and Instagram handles, and obviously Aundrea and my handles as well. George Scandalis is just the Skin Guy's just sending a big happy birthday to you, Aundrea.
Thank you.
We might have to get him on the show soon, actually.
We do.
Yeah. But thank you so much, guys. This was probably our best viewership for the live series tonight. So thank you so much. We're going to keep bringing this as long as you guys are liking the content. Thank you so much to Dr. Landells, and have a safe weekend, everyone, and wear your sunscreen. Cheers, guys.
Thank you.
Thank you. Thank you so much.